We are here with the shoulder arthroscopy attachment to Famet Żywiec operating table, but please be advised that we have, of course, another version of this accessory that is compatible generally with all the tables on the market, because the other type is mounted on the side rails. This one, however, as you can see also, this is lightweight, is installed into the tabletop itself. So we can, in fact, install it right now. This is, of course, a single-person installation unit. So right now it is attached to the table, but I have to lock it in place. So just twist it, and right now it's locked, so it cannot be disassembled or detached from the tabletop. So we are installing the accessory to a table that comes with a remote, and this piece, this arthroscopy device, is regulated by the remote control. But first, of course, we are in the flat position, and what we want to do is we want to invite the anesthesia guy to put the patient to sleep. So to do that, of course, all the time, we need to have some kind of head positioning device. So we have one right here. I will unlock one joint, one knob, and as you can see, we can unlock every pivot point that we have in here. This is a square type installation place, so we are just inserting it to the shoulder device. We can lock it in place, and right now, as you can see, it's fully mobile. So we will position it where the head of the patient will be. So we need, of course, a flat tabletop. So in this place, we have this device. In here comes a mattress. The same goes to the other side, but right now we don't have the mattresses. But of course, you can match them to the tabletop. So once again, a single knob, we can move it, and we can position it so the anesthesia guys have a lot of space, a lot of room to put the intubation tube inside the mouth and throat of the patient. So after the job is done, of course, the doctors will take over, and what we want to do is to secure the head, basically, because we will have a very numb patient, and the head can fall to the side. So we can take a little bit of angle to just catch the head with this cutout, and we don't have to reach out for any other accessory. All we need to do basically is to use our standard headrest, so we can just lock the head in place. So we are going up with one and second section, and the head is right now fixed to the sides. So we can reposition the head if you want. So one hand goes in here, and the other hand is supporting the patient's head. So I'm locking it. Of course, right now it will be useful to have another guy helping you, because we have to lift the patient to a beach chair position. So to do that, of course, we have to first lift the back section, which is the shoulder device itself. And doing that, we will, of course, reposition the head all the time, because the patient will be moving up. But you can see how easy it is. Just, for example, you can have this disconnected, and you can wait for the doctor to do the repositioning, and you can do basically the same in one single smooth motion. But I don't have anybody to help me, so you have to use your imagination. We are lifting the back section further up. We are, of course, inspecting the patient if the head is positioned correctly, and then we can proceed with the beach chair position. Of course, we have to use the Trendelenburg setting, because we want the patient to be stationary in here, not to slide out of the table. So we will do it partially. So we can inspect everything. Okay. So what we need to do right now is, of course, also to lower the leg. So we will have like a sitting position. We can do it further on. Just please be advised that the column is in here, so we can also shift the table to correctly position the legs. But right now we have the head, so the head will be probably like this. You can use this tilting, the pivoting movement, so we can catch the head so it will not slide down. You can see that we have a cutout in here. This is perfect for the skull. So we will do it like this. And right now there's a few options that we can offer to the staff. So we have multiple use positioning devices. So we have three basically belts, that three straps that will go against the forehead of the patient, the chin, and of course the top of the head. So all you need to do is to position it in here. We have the mattress, so it will be touching the patient. So like I told you, three of these straps. But we can also do it with this kind of straps. This is single use only, so we are using the disposables, but it's very easy and it's in fact quicker to use them. We have one for the chin in here and the second one for the forehead. So all we need to do is basically attach it to the patient, and then we can just simply push against the attachment, and it's already fixed in place through the hook and loop system. But as I told you before, single use only. But the greatest thing is that we can use the mask. So the mask is also a single use only device. So it looks like a flower maybe. So what we can do is basically, we can even of course install it before, because we have the cutout for the anesthesia tubes, and then lift the head up and the patient. So we can basically position it like this and then secure it by the Velcro. So it's very, very easy to do it. All you need to do is just press against the head assembly accessory, and you have the head positioned. The final strap goes in here, and it can be routed through the headrest, so it will support the head and it will not slide to the down. So whenever something is wrong, of course you can quickly reposition the device like it. So it's extremely easy to use, and also very friendly in terms of the pressure and the hygienic cases. So the other thing about the headrest, you can see that we are not pressing against the nerve that goes above the ear of the patient. It is totally secure. We are pressing the patient in another area which is nerve-free, so it will not cause any problems, any nerve damage to the patient. So right now, I have the head positioned, I have the headrest done in here, it is in the upper position. So what can I do is just move it to the side, because of course we can still have the side movements. So let's imagine that I want this shoulder to be the subject of our surgery. That is why I will move the headrest slightly to the left. I will also move the arm, so I have plenty of space in here. I can even, for example, rotate the head like this, tilt it to the side. Okay, it's fixed right now. So what I want to do is, of course, to expose the area. So one single press and the whole part will go down. So in this position, it is totally okay to have it in here. You don't have to search for anything to put it on. But if you want some additional space maybe in here for the legs, you can in fact very quickly disassemble it. But I will just advise you to leave it on. But to have more space for you to see, we can also remove it right now. So what else we need to do is to position the patient from the side. So in a while we will have the arm positioning device also installed, but right now we can go with the side positioning unit. So this is one example of this positioning. So it is very easy to use it, and it is very quick, by the way. So we can basically just install it from the side in here, so we can slide it and just press against the patient, lock it in place. And then we can, of course, regulate its position. So it is very quick to use, but it takes some space. So we have another type for different needs. So this is like a strap. And we have places of installation ready for you. So it goes like this from this side. It can be also even attached all the time. And right now, all I need to do is to go around the patient. And the same movement will be done from the other side. So in here, of course, I can regulate the size according to the patient. And right now, the guy or a girl is fixed in place, so it will not be able to, he will be not able to slip to the side. So this is the other type of side positioner. The third one is that we can install a normal standard lateral support on the tabletop rail or on the accessory rail in here. So we are 100% sure that the patient will not fall to the side, so we need to do some more positioning. Basically, we need the hand to be okay, so we can move it around. So we will install the positioning device in here, and just the same idea, one single knob, and you can see that we will have the occasion to rotate the arm in here, so we will be having a better access inside of the shoulder joint. So we can quickly do it like this, or we can, for example, take another view, so we don't need an assistant to hold the shoulder or the arm in place. The same positioner can go to the other side, but of course in here we can also install a normal arm support for the anesthesia access. This one can be, of course, removed, and we can interchange it to other positioning device with the holder, so we can use some foam to support the arm. Of course, at the end, you can also add a roller to do some traction to the shoulder joint. But what is very important, plenty of space in here also for the access to the arthroscopy, and basically it's very easy to operate. Whenever you want some repositioning, you can do it with a one single motion. The same goes for the other accessory. And after the job is done, the surgery is over, we can flat out the tabletop, and once again we can take advantage of the headrest, so it will be very easy to do the flat position again, so the anesthesia team will have a full access to the patient. So that's it, basically. Thank you.